Diabetic foot disease remains one of the most devastating complications of diabetes worldwide. It is a condition that does not just affect the feet, it affects families, finances, mobility, work, and sometimes the very identity of the patient. The question most patients fear is, at what point do doctors say, this leg cannot be saved anymore? This narrative explores that journey in full detail. How a foot ulcer starts, what causes it to worsen, what tests doctors run to determine the severity, and the exact medical circumstances that force healthcare teams to recommend amputation. For many diabetic patients, the foot problem does not begin with a dramatic injury. It often starts with something simple: an unnoticed blister, a small cut, a nail injury, stepping on a sharp object, or even friction from tight footwear. Because many diabetic patients have peripheral neuropathy, loss of sensation due to nerve damage, these wounds go unnoticed. Days turn into weeks. The wound deepens, bacteria enter, the skin becomes dark, and infection sets in. Blood flow decreases because diabetes has already damaged the arteries supplying the legs. A dangerous cycle begins. Poor blood flow, delayed healing, infection, tissue death, more blockage, gangrene. Not every diabetic foot ulcer leads to amputation. Many can be saved if caught early, but certain warning signs indicate that the foot is moving toward a critical stage where saving the limb becomes impossible. To understand when amputation becomes necessary, you must first understand why the ulcer refuses to heal. 3 major forces cause diabetic foot ulcers. 1. Neuropathy, loss of sensation. The nerves supplying the foot are damaged by long-term high blood sugar. The patient cannot feel pain, heat, pressure, or injury. They continue walking on a wound without knowing. Repeated pressure causes the wound to deepen. 2. Poor circulation. Peripheral arterial disease, PAD. Diabetes causes narrowing and hardening of arteries in the leg. Blood cannot adequately reach the foot. A wound without blood is like a fire without water. It continues spreading. 3. Infection bacteria enter the open wound. Infection spreads into deeper tissues, muscles, bones. Sometimes bacteria release toxins that kill tissue rapidly. Together, these 3 form